Hello friends, today we are going to discuss about the mechanical power. So mechanical ventilation is the life-saving therapy in patients with acute lung injury, but ventilation itself can cause lung injury which is known as ventilator-induced lung injury. It is not clear how to minimize this ventilator-induced lung injury. So one concept that has emerged is the consideration of the amount of energy transferred from the ventilator to respiratory system per unit time is the mechanical power of the ventilator. So the concept of mechanical power can be derived from the first law of thermodynamics. That is, energy can neither be created nor be destroyed, but can transfer from the one form to the another. So energy is transferred to the respiratory system, which alter the lung parenchyma and causes the injury to the lung. So, for example, if there is increase in respiratory rate, it results in the chrono injury. Increase in the tidal volume results in the volutrauma. Increase in the PEEP results in the atelectotrauma, barotrauma. Increase in the resistance of the flow result into the rheotrauma. In combination of the all trauma results into the ergo. So mechanical power is the amount of energy that is transferred from the ventilator to the patient per unit time and is measured in the joules. So the target mechanical power for the safe lung is less than 17 joules, which is calculated by 0.098 into tidal volume into respiratory rate into P plus zero point 0.5 into driving pressure plus P peak minus P plate. So mechanical power on the volume control ventilation. Gattoni et al. Came up with the straightforward equation to calculate mechanical power under volume control ventilation, as the difficulty of its mathematical computation is one of the main barrier to its clinical implication. So the mechanical power on volume control ventilation is minute ventilation into peak pressure plus P plus flow upon 6 divided by 20. And this formula is different into the pressure control ventilation. So the Becher et al. Proposed a simplified method of calculating mechanical power in the pressure control, which is given as follows. So mechanical power on the pressure control is the 0.098 into RR into VT into P plate, where RR is respiratory rate, VT is tidal volume, and P plate is the plateau pressure. So there are different method of the mechanical power calculation, which is narrated by the different authors. But what I have mentioned before is the simplified way of calculating mechanical power. So we'll see what are the evidences for the mechanical power. Durin et al. In 2016 compared 787 ARDS from two independent randomized trials, that is accuracy trial and PROSEVA trial, and discovered that mechanical power was linked up to the survival with 1.03 increase in the hazard ratio per unit of power. Sepra Neto discovered in 2018 that even with the low tidal volume and driving pressure condition, high mechanical power was associated with in-hospital mortality. The data came up from the 8,207 patients in MIMIC-2 and EICU studies. Database has concluded that in EICU and ICU patient undergoing invasive ventilation for at least 48 hours, increased mechanical power of ventilation is independently linked to higher in-hospital mortality and various other outcomes. Similarly, in 2019, Zhang found that among 5,159 ARDS patients from RCT conducted by ARDS Net, the discrimination of mechanical power normalized to predicted body weight in predicting mortality was significantly better than absolute mechanical power, and concluded that the effect of mechanical power on ventilator-induced lung injury was dependent on the functional lung size. So the conclusion of all the trials is, if there is increase in the mechanical power, there is increase in the ventilator induced lung injury, which will cause the more harm. So our job in the ICU is to optimize this mechanical power. So now how to optimize the mechanical power? So driving pressure has 4 times more impact on the mechanical power than the respiratory rate. So mechanical power equations state that tidal volume and RR can be limited to control mechanical power. However, we try to reduce mechanical power by decreasing minute ventilation. Insufficient minute ventilation and thus CO2 retention can occur, contributing to severe hypercapnia induced acute cold pulmonary if pH is less than 7.5. So there are two main ways to optimize mechanical power without excessively elevated PSU. That is, reduce PSU2 production or improve ventilation efficiency. The ability of CO2 clearance at the expense of mechanical power required is referred to as ventilation efficiency. Increasing ventilation efficiency means increasing CO2 clearance without increasing mechanical power and decreasing mechanical power without decreasing CO2 clearance. So we can try following things on ventilator to decrease mechanical power. So one is individualized PEEP approach, then low tidal volume, that is 4 to 6 ml per kg. Start with 6 ml per kg. If mechanical power is high with normal PCO2, decrease the tidal volume up to 4 ml per kg. So now low tidal volume and low plateau pressure. Thus mechanical power will decrease provided patient doesn't have hypercarbia causing pH of less than 7.25. Decrease respiratory rate so that equation of mechanical power should decrease. In volume control ventilation, additionally flow and the minute ventilation can be decreased to decrease the mechanical power. So these are the ways of optimizing mechanical power, that is reduce production of the CO2 by sedation, analgesia, paralysis and fever control. Then enhance ventilation efficiency by reduction of the dead space. Uh, that is by end inspiratory pause, prolongation, prone position, and PEEP optimization. And best match of tidal volume and RR by using adaptive support ventilation. So regarding adaptive support ventilation, the study showed that adaptive support ventilation reduced the mechanical power by adjusting I by E ratio based on minute ventilation in the patient compliance so that minimizes the mechanical power. The ECMO will provide the rest to the lung and reduce the mechanical power. Thank you guys.